I'm going to go ahead and do the introduction, everybody. My name is Alana, and I'm the room monitor for this presentation. If you could all please mute yourselves to ensure less static feedback during the presentation. If you have any questions, please put them in the chat box or save them until the Q&A portion of the presentation. If you can also make sure your full name is located at the top of your video, especially if you are in the Chicago School program. I'm going to go ahead and pass it off to Ms. Bonnie whenever you are ready.
Thank you. Great to have everybody here. I'm going to go ahead and start sharing my screen. Make sure the sound is on for that. Okay. Oops. Didn't mean to do that. Let's see. Okay. Oh yes, and this will be recorded. I'm gonna go ahead and ask Dr. Schultz to record it actually. I forgot to hit record. I'm Bonnie Bixler, and this is Dr. Schultz.
Hi everyone, welcome. So glad that everybody could join us today. It's a very exciting opportunity to be able to be here, and you know, I've just been feeling so grateful for the privilege that I have. I'm continuing to be able to work, you know, I'm healthy, and being able to engage in these opportunities, and so that heightens the excitement. And then I really want to take a moment to acknowledge the hard work and passion that you'll hear from Bonnie today. This really is her endeavor. It's been her idea, and the bulk of the preparation has been hers as well. You know, Bonnie's just completing this term her first year in our clinical mental health program at Oregon State. So we see her advancing, developing really quickly, and I'm sure, going to be a wonderful, wonderful addition to the world of counseling. I'm going to do my best to monitor the chat as we go. I'm not always the greatest at multitasking, but I'll do my best to be monitoring that. So yeah, let's keep going.
All right, thank you, Dr. Schultz. I appreciate that. And thank you for helping with the presentation. So let's see. Oh, this was your slide.
Yeah, I was just going to continue to introduce even the scope of this presentation. We're really interested in just helping support people's continuing learning about animal-assisted interventions in counseling. And so as you had read in the description, our focus is going to be on just the encouragement and knowledge gaining, and just with respect to how we are partnering with animals with respect to human well-being. So this is just a quote from the Veterinary Medicine Association. And so specifically we wanted to touch on the, I'm gonna make sure I get all my acronyms right, that we would be touching on animal-assisted therapies, animal-assisted education, the activities, the AAA that we are involved in and you are likely already involved in, and the RA, the resident animals who are already living full-time in facilities, typically owned by facilities, and provide care and emotional support for staff, volunteers, and in particular the residents. So this is just the broad scope of what we're going to be talking about this next hour.
All right, thank you. So I guess I didn't format this very well, but it's supposed to say partnering with animals at the top. So I'm going to talk a little bit about oxytocin first. According to Chandler 2017, oxytocin is produced in the human-animal bond and helps activate the parasympathetic nervous system, which is linked to growth and restoration. Chandler goes on to say the more benefits of animal-assisted therapy may include increased motivation to attend therapy, distraction from pain, potentially increased duration of therapy, and easier formation of trust with the therapist. According to va.gov, there is evidence of lower blood pressure, reduced risk of cardiovascular disease, lessened anxiety, pain, and loneliness. Time with therapy animals not only promotes physical and mental health, but also supports wellness across variables such as social interaction, rate of recovery, and personal motivation. Psychology Today stated that some studies suggest animal-assisted therapy can be helpful for those with depression, addiction, autism, and more. Finally, Scandinavian countries and Native American tribes are some examples of cultures that value animals in some form, and St. Francis is a religious icon associated with animals. So the cultural significance there was a piece I just wanted to add in there. Some inspirations for this presentation were just that I have loved animals from an early age. In the top left corner, you'll see a picture of my grandfather, who recently passed away. He was an artist, a wildlife artist, a veteran, and he always had a dog. So I grew up with his animals. I found my own spiritual connection and significance with them as a result. In the world of therapy, animals have unconditional guard, keep confidentiality, and possess good intuition, in my opinion. I believe working with them could safeguard against burnout, secondary trauma, and assist clients feeling more at ease. Also, I just want to add in a little plug. Myself and my cohort at Oregon State University are currently seeking practicums and internships for the next couple of years. My email will be at the end of this presentation if you or someone you know might be interested in that. And I'm going to go ahead and hand it back over to Dr. Schultz.
We thought it would be fun to share with you our connections with animals. And these are two of the loves of my life, just so you can see, and they always make me smile. And I just wanted to take this moment to reiterate the work around the human-animal bond, because if you're in this presentation, it's likely that you already understand just intuitively what it is to be bonded. But these two particular friends were very, very near and dear. It's like my cat, she would follow me everywhere. I never, ever was concerned that I would lose her, because where I went, she went. And she just needed to be around me and me her. So it was just something for me that was very unique and very special. So I think we can all understand just intuitively the pet effect, and understand really without even needing to see data, the impact the animals have on people needing some care and support, and how we communicate with them on that level. There is HABRI, the Human Animal Bond Research Institute, if you have interest in understanding in more in-depth research about that pet effect. And the work that they do is primarily focused on childhood health and development, as well as healthy aging and mental health in association with animals. So thanks for offering the moment to see my two very beautiful friends that I miss greatly.
They're really cute. So For clarity purposes, here are some of the terms we'll be discussing defined. And according to a study by Lloyd, Johnson, and Lewis in 2019 regarding service animals, quote, most common tasks performed were reducing anxiety through tactile stimulation, nudging or pawing to bring back to present, interrupting an undesirable behavioral state, constant body contact, and more, end quote. Also, according to the ADA, there are only 2 questions people may legally ask an individual with a service animal. Is this dog a service animal required because of a disability? And what work or task has the dog been trained to perform? And here is just a visual representation of these terms. Pets, emotional support animals, and service animals can all be animal-assisted therapy animals. So I know it's confusing, but hopefully this slide helps clarify the differences. And then this will be an interview with my friend Clay and his service dog, Elodie. He's just going to talk about his experience having her. So I think it demonstrates the impact of the human-animal bond, and I hope you enjoy it. Oh, and you can follow Elodie on Instagram at Really Happy Frenchie. Hi, Clay. How are you today?
Good. How are you, Bonnie?
I'm good. For everybody watching, this is my friend Clay Murdock, and we have a special guest, Elodie, his service dog. Hi, Ailey.
Hey, hi. You're on TV?
What advice would you like to give counselors and the other professionals hearing this presentation about how you would like them to help people in your situation with a service animal?
So I would say I'll talk about specifically about diabetics. I think the biggest thing for me is like I'm a healthy looking person. I don't have a problem walking. I need a wheelchair. I'm not blind. Like there's not a obvious physical disability that people see right away. So a lot of people, and I would assume even with like emotional support animals, anyone that looks otherwise healthy is probably going to deal with a little more stress just having the service animal. And you do get really attached to your animal. I bought her first as a pet, so like I love this animal, and the thought of dealing with the stress of losing her or people not treating me well because she's around me or not treating her well, it can lead to a lot of stress. Like I've had so many negative encounters that it would like it's led to anxiety about, do I even take her in the store? Like, do I need to just leave her in the car for this trip into Walmart, or this trip into the mall? Like, because there might be like one security guard at the mall that has seen us before and knows she's a service animal, but some of the people in the stores might not know it. So like there's like a level of stress that comes with her for someone like me, and I don't normally have a vest on her. I don't own one. I'm not required to have one. The ADA guidelines are really basic. Like if she performs a function for someone with a disability, she's a service dog. Like there's a lot of times people be like, well, bring in your paperwork next time. We'll let it slide this time. So there's a ton of misinformation. I would definitely say the person with the service animal should get really comfortable with knowing what their rights are and really comfortable with explaining them calmly, because there's a lot of times where like me with diabetes, if my blood sugar is really low or really high, I'm really easily agitated. I can lose my temper, and I don't know that's gonna come on. Like if I haven't checked my blood sugar recently, I don't know where I'm at. So if my blood sugar is high and somebody does something that's minorly annoying to me normally when my blood sugar is level, when my blood sugar is really high, something minorly annoying might just send me off the top and I might start yelling at someone. It's happened a lot of times. So I think working, and I've worked with my own counselor through things like this, but like preempting those situations. So what's your plan when you encounter that negative situation? Because like I said, it's been, there's so many times where I've not taken her with me, and it's been just because I didn't want to deal with the stress. Like I'll leave her at home, or and a lot of times if I have a sedentary job, if I get to walking and moving around, go shopping, and I've been sitting all day, haven't eaten enough, my blood sugar will drop at the store. So it's important to have her there. She knows what my blood sugar is doing when I'm not paying attention, and that's usually when she alerts me, is when I'm not paying attention. So it's working around the stress of using a service animal at an emotional level is probably the biggest thing for anyone that's not obviously disabled to the public in general.
All right, we will hear more from Clay towards the end of the presentation. And I'm gonna hand this back over to Dr. Schultz.
In listening to Clay, something that really stands out for me is just the experience on the other side of partnering with animals, because often in a training perspective, it is the counselor with the animal training together to provide a service to clients. And with Clay's really talking about, he's the person that's partnering with an animal and how he makes use of counseling to deal with the circumstance and some of the stigma and the microaggressions that he experiences. And as Bonnie mentioned, we'll step back into that topic a little bit more. We did want to follow through with our topic and just introduce to you animal-assisted therapy in and of itself.
Oh, you're cutting out, Dr. Schultz.
Oh no. Well, okay. I'm not sure I can do anything about that in the moment, because all of my internet business, I will just turn things off.
Oh, there we go.
Okay. See if I can reduce the band use a little bit. Sorry, y'all. Well, so let me step back into saying that Bonnie received permission from Simple Sparrow Care Farm to use some of the pictures, these photographs that you see, that you're going to be seeing from their site, because they're just so telling of the work that can be done. So this particular picture is to show the partnering of humans and animals. In particular, this one is the caption reads, "How to integrate farm into therapy." Marty Smith, who is that therapist, makes fun out of therapy while she works with clients on eye movement and vestibular stimulation. Find Jacopo, she sings, and the children join in. So we just thought it was a really lovely way to demonstrate how we can work together, and it doesn't have to be stereotypically working with dogs in a room, and it can be in a variety of settings where animals can partner and support humans in coming to understand themselves and in the world in which they're living.
All right, thank you. So with that, what is animal-assisted therapy? Chandler 2017 defines it as incorporating the talents and traits of a therapy animal into a therapy setting to facilitate recovery. And then I want to invite Dr. Schultz again to talk about ranch hands rescue.
Just the idea, I wanted to just be able to comment about different facilities that are out in the world. This particular one is in the North Texas area. Ranch Hands Rescue is an animal sanctuary that supports neglected and abused animals that comes to its door. And as the animals are healing, they're also providing support for the clients, the human clients that come to this particular facility, who are also dealing with chronic abuse and stress, anxiety, and together the animals and the humans are finding new ways to reconnect, to trust. And it's just a lovely example of how animals can be used in creative and meaningful ways for both the human and the animal. So I would venture to say that there's hopefully something in your local area that is utilizing a similar model. And I think many of them offer support for horses, and Ranch Hands just accepts all kinds in their sanctuary. So it's just, if you have an opportunity, the URL is there for you to just go check out what they do, and maybe that's something that's in your future.
Mm-hmm. Thank you. I would also like to add that I was very surprised to learn that we have numerous care farms all over northwestern Montana, where I'm from. I had not heard about them until I went to a conference topic about care farming. So yeah, it's pretty neat. So I wanted to go over the training requirements for both the therapist and the animal. Obviously, if you are wanting to work in a therapy setting, it is good to obtain a license in the therapy field. The certification requirements specifically for animal-assisted therapy can vary by state. However, it is recommended to receive training in animal-assisted therapy. And I have listed a few of those programs that offer this, both here on the slide and at the end of the PowerPoint. And we'll be sharing the link to this PowerPoint at the end in the chat as well. And then here are also some options for training a therapy animal. Just some different organizations that offer that certification for the animal. And then while I was reading Dr. Chandler's book, which I'll be referencing quite a bit in this presentation, I learned some things that I had not considered, so I wanted to just put them on the slide and share them with you. Things like ethical considerations for the animal are very important. Being culturally aware of how people will respond to the animal and how they perceive them is important. And then just the ability to facilitate those client and animal interactions was another thing I hadn't really thought of. I kind of thought maybe it would just happen naturally, but we are an active participant as the therapist. And then also another thing I didn't know was that sometimes those attachments between the animal and the client can be very strong, and so we have to keep in mind that at some point when that relationship ends, we'll have to kind of have an idea of how to gently facilitate that. And then this slide is for Dr. Schultz.
Mm-hmm. Yeah, I get the fun, wonderful pictures. This is just a lovely picture, isn't it? Again, it's one that we're using with permission from the Simple Sparrow Care Farm. And the caption of this one reads, "This sweet girl and her mom got approved to rent their own apartment today. Her mommy is a survivor of sex trafficking and has been working at Simple Sparrow Care Farm since December. It's the first legal job she's held for this long. Her mommy's work at Simple Sparrow involves caring for the animals, learning to work with others, and tending a garden. She loves her work because she feels valued and purposeful. Thanks to a generous donor, we've been able to keep her mom employed, and she earned the money for down payment to rent an apartment all on her own." And what really strikes me here that I'd like to share is how this photo epitomizes how someone who may be feeling helpless and powerless can partner with an animal who also may be feeling helpless and powerless in the world, and how together they can build resilience. I think is really lovely. And so as we're just taking these few minutes to think about prevention, I thought I would invite you to use the chat to come up with your ideas about how you might consider partnering with animals in preventive sorts of ways. Because the majority of the conversation tends to be around intervention. And here we just wanted to take a bit of an opportunity to think about how to be preventive with the use of animals.
All right. So this study measured the effects of exposure to a household pet cat or dog during the first 12 years of life and having a subsequent diagnosis of schizophrenia or bipolar disorder. The study found exposure to a household pet dog at birth and during the first 3 years of life is associated with a significantly decreased hazard and relative risk of a subsequent diagnosis of schizophrenia. So just something to keep in mind for prevention. And I'm going to try to get through, I'm going to talk a little bit fast for these next couple slides because I have a lot of information I want to share with you before we get to our video. Since the article we talked about in the previous section on prevention looked at individuals with schizophrenia and bipolar disorder, we wanted to look at and compare possible interventions for these people, as well as more interventions for individuals with PTSD. First, we will talk about why animal-assisted therapy in service animals could benefit veterans in particular. So veterans and service animals, companionsforheroes.org states, quote, "An estimated 20% of veterans returning from Afghanistan and Iraq have PTSD and or depression. When traumatic brain injuries are factored into the equation, the percentage of veterans suffering from debilitating symptoms such as severe social anxiety, flashbacks, nightmares, and hypervigilance is much higher," end quote. From this information, we can see why veterans are a population that could very much benefit from service dogs and animal-assisted therapy. Also, just a little fact for you, dogs are the most common animal used in animal-assisted therapy and are typically categorized according to the level of training received in the specific needs of the individual. Other animals often used with veterans are horses. So talking a little bit more about interventions, just related to that last prevention study we shared. In general, according to Chandler, 2017, some clients will respond better to therapeutic interventions that involve a therapy animal than to therapy without an animal. Some basic therapeutic goals and interventions can actually work better with therapy animal facilitation. For individuals with schizophrenia, Brannon 2014 states that service animals help them feel more secure and cared for, plus gives them something other than their condition to focus on. Calvo and others, 2016, found that animal-assisted therapy appears to improve positive, negative, and emotional symptoms. Some studies, such as Grant and others, 2012, show that cognitive therapy helps improve client functioning. So what if we combined animal-assisted therapy and cognitive therapy? I would like to see more research on this, and I believe combined, we would see a greater number of positive results. For individuals with bipolar disorder, the previous prevention study did not find a lot of evidence, unfortunately, for this population as far as prevention. But service animals can interrupt symptoms in the moment, according to Thompson, 2010. And that's for intervention. Then Chandler, 2010, states that oxytocin deficit allows the physiological stress response to become hyperactive for people with bipolar disorder. So if we reverse that and think about exposure to these animals increasing the oxytocin, I think that's kind of a physiological way they can help balance that. So moving on, according to Collingwood 2018, talk therapy on its own may not be effective and is best treated using a combination of pharmacology and psychotherapy. So again, that pharmacology and physiological connection were something I was looking at. So for individuals with PTSD, including veterans, Brannon 2014 says that service animals can provide safety, security, comfort, and nurturing when panic attacks arise. According to ptsd.va.gov, the most evidence-based trauma therapies are prolonged exposure, cognitive processing therapy, and EMDR. According to Mims and Waddell 2016, animal-assisted therapy led to an 82% reduction in symptoms for survivors of trauma with PTSD. I thought that was like a very significant result. Oh, I saw a little more on this one. I wrote down a lot. For individuals with PTSD, including veterans, Brannon 2014 says that service animals can provide, oh, I already read that part. I'm sorry. Okay. Right, we're on slide 20. Okay. Simple Sparrow Farms provided a study by Tanner, Smith, and Crockett 2018 that looked at the blood pressure of participants before and after holding a bunny for 20 minutes. This study found that 70% of participants experience a reduced resting blood pressure. So just the more physiological effects. And then Smith, Tanner, and Johnson 2019 indicated that several program participants at Simple Sparrow Farms reported reduced frequency and or duration of suicidal self-harm thoughts. And then just some more studies about appearing more calm by Casey and others in 2017. I'm going to try and move on to the next slide. So, and then I'm going to hand it over to Dr. Schultz.
Yes, and again, a wonderful photo. The caption for this one reads, D, a survivor of trauma gets help from a chicken and a cat while she plants flower bulbs. And by help, we mean we had a good laugh trying to plant the bulbs deeper while the chickens scratched them up while giving a cat a piggyback. So it's just a sweet, really sweet picture of the bond and then the nurturing that is bidirectional. And so as we are shifting into this idea of more stigma, and we'll come back to Clay here in a minute as well, we just found, Bonnie, I should say, found a really very interesting video that really speaks to microaggressions and how we as these helping professionals can use this awareness to broaden our competence, multiculturally, with respect to how society is functioning around these issues, and to be able to support more genuinely and authentically the experience of people who are on the receiving end of such microaggressions for having an animal.
Yeah. And I'm going to try, let's see, how much time do we have left, do you think, to show these videos?
So 10.
10 minutes?
Mm-hmm.
Okay, so I'll probably go ahead and play the whole video then.
Do not pet. I'm not supposed to pet you. No, I'm not. But you're so pretty. You're so cute. I'm not supposed to pet.
Oh my goodness. Sorry about that. We'll try this again. To drag. I was trying to keep that from happening, but oh well, we'll roll with it.
Is that a dog? Why do you have a dog in here? Wow, your dog is so well behaved. If I brought my dog, he'd be peeing on everything. Why do you get to bring your dog in public?
So, who's disabled?
Why do you have a dog? Is she in training?
Oh, you're autistic?
How does a dog help people with autism? Is she in training? I thought dogs were for blind people. Oh, you're autistic? You must be really high functioning.
You don't look autistic.
Some kids just misbehave. Aw, you remind me of my dog.
She died last night. What is 6 times 80,000 plus 7 divided by 8 to the power of 700?
Wait, you can talk?
Hey, the dog can stay, but, you gotta go.
Is she in training?
ADA? The American Dodgeball Association?
Wow, you must be really organized.
Don't worry, I'm sure they'll find a cure.
You don't need a dog for autism.
Oh, but you're so handsome and now you can't date anyone.
I heard autistics don't have sex. Your parents must not have done enough preventative thinking. Wow, you must be really high functioning.
I'm sorry, let me know if there's anything I can do to help.
Is she in training? Why aren't you looking me in the eye?
I'm going to steal you.
You must be a good driver.
¿Qué pasa con la pera?
Do you need me to talk quietly?
Is that a therapy dog? Is that a search and rescue dog?
Is she a blind dog?
Is that a drug dog?
Oh, just checking.
Why don't you just take pills?
You better do something about that dog. You are a person who has autism. You are not an autistic person. I would have never known. Wow, your dog is like the only way I could tell you were disabled. Is she in training? Wow, that's rare.
You need to get that damn dog out of here.
I'm sorry, I thought you were blind. You must be a really fast reader.
Oh, you must be in one of those special ed programs.
Does that mean that you can get medicinal marijuana?
I know I'm not supposed to pet you, but you're just too cute to resist.
It's a ball. It's a ball. Fetch! Why isn't she getting it? Can I pet your dog? Can I finish peeing first?
All right. Let me see if I can go back to, oh, we don't want to play any more videos. Hold on. Go back to the presentation here. All right, so that last video I wanted to share just because I think it illustrates the lack of awareness in the US about functions of a service animal. I would like to advocate for increased use of them along with therapy and emotional support animals to normalize their use across multiple circumstances. And then I think Dr. Schultz had something she was going to say before I play this.
And not specifically, but I really would like us to consider how we can advocate, more broadly with respect to the use of animals in these forms, and how in the partnership, and helping educate those around us. And for me as a counselor educator, can start in my classrooms, and let this work also be something that we speak to, a topic that we speak to in our classrooms when we're talking about developing multicultural competence, because this doesn't get a lot of play in that regard. So I appreciate the opportunity to say that.
Mm-hmm. Yeah, thank you. All right, so here's just part 2 of my interview with Clay, and then we'll open up for Q&A. There we go. What is it like interacting with the public when she is with you?
So usually it's really good because she's a cute little dog and people are excited to see her. They don't normally see Frenchies out and about, so they get really excited about her. Sometimes if I go to like a grocery store, a restaurant, anywhere that they're a little worried about cleanliness, then I have more of a variety of interactions. I've had really negative reactions from employees before, and I mean, and even non-employees will give me problems even after they ask me if she's a service animal. They'll look at me like really, like they don't respect what I've said because I don't look like I have a really obvious physical disability.
All right. So that is the end of the presentation, and we'll go ahead and open it up for Q&A. Thank you for attending, everybody. Oh, and my email is here on this last slide in case anybody is as passionate about animal-assisted therapy as I am. And again, if you know of anyone who is looking for an intern or someone to do a practicum, that is also there. So we'll go ahead and, did you see anything in the chat for questions, Dr. Schultz?
Yeah, and appreciate folks demonstrating their appreciation. It's really supportive. There were some really great ideas just of how people are already utilizing their animal friends in support of the work that they do. Clearly there's some people who are well experienced. So feel free also to jump in with some sense of what you know based on your experience and training about this. There is a person, Chelsea, who's asking, is there a specific organization that certifies counselors who are interested in getting licensed as animal-assisted therapists?
A specific school? Let's see, I'll go ahead and go, if I can. There's a slide at the end here. Not that one. Training opportunities. So we have, so the question was, are there places that train animal-assisted therapists, correct?
Organization was the word.
Organization. Oh, okay. So these schools are the only ones that I know of. As far as organizations, I believe Dr. Chandler talked about pet partners, which is, it might be on this slide. If not, I know it is called Pet Partners. So if you want to write that down, I think they and some other organizations that we talked about that talk about training the therapy animal kind of integrated some of that. Let me see if I can go back to that slide really quick. Training, okay. Okay, there's the Pet Partners link, petpartners.org. And I think they were the ones that were kind of integrating that training more, both for the animal and the therapist. I would also recommend getting Dr. Chandler's book. Let me see, I'll go ahead and exit this slideshow and pull up my Kindle really quick so you can see the book. Just if you want more information.
You know, something that I can add here too is I used to work at University of North Texas, where Dr. Cynthia Chandler currently works and where she has her consortium. And so some sort of training in animal assisted is, you know, certainly highly recommended and ethical. If you're working with horses, EAGALA tends to be the standard for training and professional support, and it is EAGALA, and they call themselves that, a global standard for equine assisted psychotherapy and personal development. So something that's part of a conversation that Bonnie and I had, that states clearly offer different recommendations, but regardless of what is required in your state, we would want to be ethical in our work. And so some form of training and specialization is necessary to be able to work well and be able to understand the implications of the work on the clients as well as on the animals that you're working with.
More questions? Let's see if I can catch up in here.
Here's, I'm just making sure I didn't miss one, but here is one from Alina. Do landlords have to allow animal assisted therapy dogs into rented counseling offices?
Ooh, that's a good question. I think that might depend on state law. Honestly, I don't know. The distinction, though, again, I'll go back to this slide, is the service animals are really the only protected animal. So if it is a service animal that is also an animal assisted therapy animal, I think you're good to go. But from what I was reading, the animal assisted therapy animal designation on its own has to be invited to a facility. And that's more, I was thinking of hospitals when I read that. So I think it's something you might want to look into. I would recommend maybe checking out the ADA website or using their Q&A format. Good question.
Mm-hmm. It is a really an appropriate consideration if you want to be providing animal assisted therapy. I know landlords do have some opportunity to designate via their lease what they'll allow and not allow. So verifying the state law as well as federal would be very wise to do. Because to be honest, I am not aware of a state law in my current state of Oregon that would prohibit So I would
Yeah.
think so in negotiating with your landlord in that regard.
Mm-hmm. For sure.
So Adria asks, so animal-assisted therapy into practice, how would you recommend assessing that it would be appropriate and beneficial?
For the client or the dog? Guess I'm a little...
Well, both. I mean, both.
Okay.
I think it's appropriate to respond for both. Yeah.
Yeah, okay. So I'm not a clinician, so maybe you
Yes.
can speak to that a little bit more. I guess it depends on the individual, what their needs are, if they are interested in animals, or do they have allergies? Would it be appropriate for the animal to work with them safely, having their needs met? That's my initial thought. I don't know if you have any other thoughts.
Yeah. I think if you are a person that is trained, you have some experience, like through your practica, your internships, and you're ready to like identify as someone who works with animals, then that's going to be part of your professional disclosure statement. And you're going to attract clients who might be interested in having that experience. And then those who may not have an awareness, that's going to be part of your disclosure work with them, like the intake. You work with animals, and as Bonnie mentioned, if there's allergy issues, it might not be a good fit. So someone in the chat, and I don't recall the name in the moment, said it's like perhaps when you're working with children, how might they work with a plant to know how they might work with a pet, because you certainly don't want to put your therapy partner in a situation where they're going to be harmed in any sense either. That's part of creating a relationship with someone. You can start to check it out. But if this is a service that you offer and you market yourself as such, I think you're going to be attracting people who really would like to have that experience.
Mm-hmm. Yeah.
Actually, just something that popped into my mind. I have never been around horses very much, and just wanted a different sort of therapeutic experience for myself as a person. And I happen to be living in Texas, and there's quite a bit of opportunity to be around horses there. And so identified someone who provides equine assisted therapy, went out and had some trepidation about being around horses, and very quickly found that the horse helped me feel really comfortable. It really wasn't the human being, it was the horse that sensed whatever I was putting out there and made it really okay for me to touch and be around, because I find them to be beautiful creatures, yes, but a little bit intimidating to me. And just, I found it so extremely therapeutic in my own personal world just to be able to touch. And I often say lay hands on, when I could just come and touch that horse, and that horse would allow me and want me to engage. It just felt so wonderful. There was a real healing experience for me in that process. So I know as you go through your training, these are great questions you're going to be asking and wondering. And I would encourage, if you're on the beginning end of this process, to maybe go find somebody local who's practicing and go have that experience as a client to understand what that feels like for you. Because if you're going to enter into it as the counselor, you really want to understand how this experience will impact your clients. So a lovely and a really lovely creative way to help clients engage and sort of learn to trust. Talk therapy is wonderful and works for many, and having options and alternatives to talk, I think, is really very valuable. So if you, again, are in the beginning place, maybe consider how you might add into your repertoire as you grow.
Yeah. So I don't know, do we have time for, we might have time for one more question if anyone has one.
You have about 2 minutes.
Okay, yeah.
Question. I'm gonna
Anybody
go ahead and
else?
share my screen. Meanwhile, we have a sponsor, and that's Tavera, just so that everybody can see.
Oh, okay.
Meanwhile.
I'm familiar with Tavera. Really appreciate their support.
Yeah, thank you.
And, you know, and Clay, I noticed that you are here, and while I do not know you, appreciate your support of your friend Bonnie and in providing interview as well as your presence here for her today. That's great.
Yeah, thank you, Clay. I saw his little comment pop up. I was gonna send him a message later. I really appreciate it. I had more people interested, well, I was interested in interviewing at least one, and he declined, so I'm glad I had at least one good interview in there.
We certainly thank you for your interest and sticking around and hanging out with us today, and to the Chicago School also for providing an opportunity, and especially for students to present their passions. That's lovely.
Yeah, thank you so much to the Chicago School for presenting this opportunity, and to Dr. Schultz for bringing it to my attention.
Thank you both for your presentation.
Yeah,
Yeah.
appreciate it. Take
right.
care all.
Yeah.
Stay healthy.
Bye, everyone.